In this lesson, we'll discuss the therapeutic relationship. Clients do better in treatment when they trust you and feel safe with you. They do better when they have a strong sense of connection with you, confidence in you, and a sense of shared humanity. And they do better when they believe you care about them, when they see that you're adapting treatment so that it's right for them, and when they see that you're working hard to alleviate their suffering. How do you develop and maintain a strong therapeutic relationship? This is a really important topic that I cover with my psychiatric residents at the University of Pennsylvania in our very first class. I go over a number of ideas with them and then have them write a card using their own words. Here's what was on the card of one of the residents whom I recently taught. It said, "I should treat every client at every session for the rest of my career in the way I'd like to be treated if I were a client." It's important to be a nice human being in the room with every client. I need to help the client feel safe. Clients are supposed to have difficult problems. That's why they're clients. Now listen as Dr. Beck describes how his view of the importance of the therapeutic relationship changed over time.
I used to think, for many years, even decades, I used to think that the therapeutic relationship was a crucial vehicle, crucial part of the therapy. And this little bit like a surgeon using anesthesia. The anesthesia is essential in order to apply the techniques. Way back, I remember having debates with Jerry Frank, who was a big believer in the curative power of the therapeutic relationship itself. I felt at that time, and still do today, that the technical aspects are really crucial, but that the therapeutic relationship might be, is an extremely important facilitator for being able to deliver the particular techniques.
Next, I'd like you to review the therapeutic relationship checklist. You'll find a link for it below. Refer to it as you watch a clinical roundtable to learn how to develop a strong therapeutic relationship. What do you do to develop a good therapeutic alliance with your clients?
One thing is just to start with those basic therapeutic counseling skills. So the empathy, the being warm and genuine, the showing interest, like, leaning in, using your body language, using your facial expressions. And that can really help develop that trust between you and your clients, and just show that you are listening, you can understand where they're coming from, and you value what they're saying. So I can think of a client from actually yesterday. So I had this high school student, she comes in just looking really dejected, and she says, okay, for one of the agenda items, I want to talk about my grade, I got a B. And, I'm thinking, it's a B, but she's looking so sad. And what I said to her is given I knew her background, I really seems like you feel just so exhausted having those high expectations from your parents and the expectations you place on yourself. And she just said, yeah, it's just really tough.
So that accurate understanding really helped.
Yeah, exactly.
What else do you do?
You can start from the very first minute that we have with them when we build that teamwork. That we make joint decisions together. The very first thing that I say to patients is, what would you like to work on together? What would you like to work on today? What would you like to accomplish today? It means we're working together. By asking them, what would you like to work on first? So they have a hand in prioritizing, setting what's most important to work on in the time that we have together. Asking them for summaries. What'd you get out of the last, what'd you pick up? What'd you learn from the last few minutes of our session? And in terms of helping them, or actually not even just helping, but actually having them take an active role in the setting of homework, builds that alliance. And also, what helps is when we do something that works in that moment. There's a patient that I saw yesterday. I asked him what he wanted to put on the agenda. He said, I just want something to make me feel calm right now. I just want to feel calm right now. So I led him through, on that agenda item, what he wanted to work on, what he was motivated for, of doing a relaxation exercise, of doing visualization exercise, of enabling to watch some of his thoughts at that point. And at the end of the session, he was a satisfied customer. You know, nothing succeeds like success.
So the relationship really gets strengthened when clients see that you're helping them.
Yeah, when you give them something that works, give them something that works, that really helps build that alliance.
Something else I keep in mind is I look for and listen for any opportunity to give positive reinforcement, particularly with patients who are depressed. They are not feeling particularly good about themselves. There's often a lot of critical thinking going on, and if there's anything they talk about that they could give themselves credit for, I point that out.
Can you think of an example?
Yes. I'm working with a woman who is so depressed, all she really wants to do is stay in bed. And so the days that she gets up and goes to the store and gets groceries and then makes dinner for her family, that's huge for her. And then I can point that out and help her recognize that that's pretty good for someone who's as depressed as you are to accomplish these things despite your depression.
So it's kind of doing double duty there, because on the one hand, you're positively reinforcing her, which can help strengthen the relationship. You're also modeling for her a different way of viewing these activities that she didn't really see as accomplishments.
That's right. And thirdly, I'm introducing the notion of giving yourself credit for even small tasks.
And with us providing our clients feedback, I think another important part is us getting feedback from our clients. So at the end of every session, we elicit feedback. We say things like, how was today's session for you? Was there anything I did that you didn't like, or you think I could do better next time? And is there anything you didn't think I understood really well? And what this does is it gives the clients the opportunity to let us know anything that they'd want to be better. So like Norman said, it's being collaborative. It's saying, what would you like to see change? And let's make that happen. So I had a client where he said at the end of the first session, he said, you know, Rob, I've been in therapy for years and years and years. All my therapists are very empathic, but I didn't get anything done. He's like, you can just cut out that empathy. He's like, I don't really need that. I just want to get to action. So I said, you know, first, any time I get negative feedback, I say, you know, I really appreciate you telling me that. So I'm positively reinforcing that. And then I said, next session, I will do my best to try to cut out the empathy and really just get to work. And if I don't, would you let me know about that in the future as well? I said, great. So next session, cut out the empathy, got feedback again, and he said that was a lot better.
You know what's so wonderful about that? It points out that you need to adjust the relationship according to the client. So most clients like direct expressions of empathy, but not all of them do.
That's right. Most clients seem to like a little self-disclosure, especially when I say something like, oh, I think that way too sometimes, or that happened to me. But occasionally I have a client who I can tell will look away or look down, and they don't really want to hear that I have a shared experience. So it's good for me to know. I adjust my approach, and it really helps us develop a therapeutic alliance.
All right. Yeah. We give them what they want so that we're in a better position to give them what they need in the course of therapy. But that's how we build that alliance.
And when we ask for feedback, we really do want to know. When you were talking, Rob, I was reminded of working with a man who, at the end of the session, I said, is there anything I could have understood better, or is there anything that I could have done differently to be a better help to you? And he said, well, when you said this and that, it reminded me of my ex-wife. So I said, I'm so glad you told me that, because that's not going to be helpful. And so we went from there, and we really did develop a good working relationship.
How important it was that you asked for that feedback,
Yeah.
right?
Oh, yeah, that reminds me. Early on, I remember asking a patient, was there anything that I said that bugged you? And she says, yes, the word bug.
Okay.
So you got everything else right.
I hate bugs.
Okay.
And that evoked an immediate negative response in her. But we were able to go through that.
And I think kind of an overarching idea in therapy is just us being as transparent as possible. So throughout the therapy process, I'm letting clients know exactly what I'm doing and giving a rationale for why I'm doing it. And really the big reason behind here is we want to teach our clients to be their own therapists. So we have to let them know, okay, what are we doing to help you get better so that they know what they can do for themselves once therapy's over. So we can also use it just to tell them or let them know what's going through our mind, just so again, being completely open, and that can help build some trust. Like I remember one time of reviewing homework with a client of mine, and they didn't complete the homework of making a call to a friend to set up like a social activity. So I said, okay, well, there's a few ways I'm thinking we can approach this. One idea is to see if there's any thoughts that got in the way of that, and the other is to see if there was any practical matter. So those are kind of what's going around in my head. Which do you think would be better?
So giving the client a choice if you're not sure of where to go.
Exactly, yeah.
Those things really, I think, help with a relationship.
Yeah, it empowers them. It really does.